Hi, everyone. I'm Megan Lane. I'm your host here today on Elder Care Podcast. And today we have Miss Carlee Coggins.
Hi, everybody.
She is with CenterWell Home Health. Carlee, why don't you tell us a little bit about yourself and CenterWell?
Yeah, awesome. So thank you guys for having me. First of all, I'm super excited about this. My name is Carlee Coggins. I'm a home health specialist that covers Wise, Jack, and Young counties here in Texas. CenterWell Home Health is the company I work for. Just a few fun facts. We're the largest home health in the nation. Our local branches have a 4.5 star rating. And I guess the thing that really separates us from, other home healths and just our competitors in general is our advanced clinical programs and the specialty programs that we offer. So that's something that I really feel like sets us apart. We have a really great wound program. So it's called Prime Wound. We basically partner with a third-party wound care physician. So it'll be somebody that comes out on site to see the patient alongside us or in between visits just to help. It's kind of that extra step. It's really kind of a new thing that some other people are using, but ours is licensed. That's the awesome part.
Okay.
And then the diabetes program, we are actually the only home health certified by the American Diabetes Association.
Awesome.
To take care of diabetics. And so a lot of times you'll see it advertised, diabetic care and management. But for us, the ADA has certified our programs. We're the first ones to know about any changes.
Oh, that's great.
Yeah. So, if anything ever kind of switches up, we're quick in acting on it, and they usually let us know ahead of time. But that certification is a big thing because when it comes to clinical excellence, that's who you want taking care of your loved ones. So,
oh, absolutely, yeah. And I feel like all of these programs are what complement right at home services so well.
Right.
This is why we make a good partnership, because oftentimes we have our clients where we're just providing the caregiving side, and they need skilled nursing as well. And yes, plenty of people that struggle with diabetes or need wound care or physical therapy. And so that's when we're like, hey, Carlee, we need your help. So yes, I love that, what we do is, the opposite, but the services complement each other so well.
And it works together too, because what I love about you guys is obviously the high level of care, because that's important to us, but also the fact that you guys take care of veterans. And that is like at the heart of your business as well, because we are licensed to take care of, we're a BA approved home health. So we are licensed to do that as well, just like you guys are. And so being able to take care of those who serve our country as well, that's always been my favorite thing about you guys. It's a really special attribute to right at home. So,
oh yes. Yeah. Near and dear to, I think, most people's hearts. Yes, absolutely. Seniors in general, our veterans, they deserve the best care.
Right.
Absolutely. We want everyone to know that, there's always someone for them in their corner. If they have family members, we're able to help them, help be an advocate with them, but also provide resources like Carlee. And for people that don't have family members, that's kind of where we step up and, show them what is available to them.
Absolutely.
So, well, in honor of February, we have Valentine's Day, but it is also American Heart Month. I hear that CenterWell has a very good cardiovascular program that could be very beneficial this month and all of the months of this year. So tell us a little bit more about this cardiovascular program.
Well, so earlier I only mentioned 2 of our 4 specialty programs. So the other one was a fall prevention program. But the one that we're here to really highlight today is Keeping Hearts at Home. So it is our heart disease program. I don't know how many people know. I feel like I didn't know as much and you didn't know as much. And so until we really started digging into this, how big of a deal cardiovascular disease is worldwide, but especially here in America. 129 million Americans suffer from cardiovascular disease of some sort, whether that be heart failure, stroke, heart disease in itself. They're in that category, and 71% of those individuals are geriatric adults.
Wow.
So I think that was something that was kind of a thing for us to take back and, be like, wow, because until you're, really aware of what's going on, it is an epidemic. That's what it's being called on the clinical side, because there's the increase of what we're seeing. And then 2, it's also the leading cause of rehospitalizations and deaths in America as well.
Wow.
So, we're dealing with something that's not just something small, something that, we know everything about. It's something that we're trying to, battle and overcome each and every day. And so our program is really to help combat the symptoms and the mortality rate that's behind heart disease, and helping people have longer lives, and helping physicians as well monitor those patients.
Yeah. I think what they say, the silent killer. Mm-hmm. Sometimes you don't always feel the symptoms. I think most people think, oh, if something's wrong, I'm going to know. It's not always the case. Even myself, like whenever I go get checkups,
right,
they're always like, oh, your blood pressure is a little elevated, or this is a little high. But on an everyday basis, I don't feel that. I don't know that. And they're, oh, are you stressed? Well, I don't feel stressed. I always like to think of myself as being pretty calm natured and, but no, apparently, even with how calm I think I am, blood pressure,
right,
through the roof, just like that. So I think regular checkups, definitely important. Even if you don't feel like you need them, you don't think it's going to be beneficial, go get a checkup. It never hurts to hear, what the doctor has to say. Let them run some tests, be sure.
Right.
But especially with women, I was reading that actually heart disease is the leading cause of death among women in the United States, which it kind of surprised me. I think, well, myself and probably most people, we always tend to think it's more so with the men.
Right.
And that's not true. That's not the case.
It's the silent stress. And, too, mm-hmm. something that we have to realize as well, I feel like, as society, is the causes of cardiovascular disease, whether that be heart failure, heart disease, strokes, different things like that. We have hypertension. Mm-hmm. So just what we kind of spoke about, mm-hmm. obesity. And then yes. alongside obesity is diabetic or diabetes. So being pre-diabetic or in that category, that's another condition that kind of contributes there. And so whenever you have those causes, how many of us struggle with stress? How many of us struggle with our blood pressure? How many of us maybe are diabetic? So many people have diabetes. And mm-hmm. whether you are currently suffering from a cardiovascular disease of some sort, even just being in the pre-diabetic category puts you in that. In our side, we have classifications. So we have class A, class B, class C, class D of heart failure.
Okay.
And so even just that pre-diabetic diagnosis of diabetes can put you in class A for heart disease.
Okay. So definitely want to catch things early.
Right.
So that you can start being, if you haven't been proactive, you can start acting now to try and reverse some of those symptoms.
Absolutely.
Diet,
mm-hmm.
exercise. I guess, what are some of the things, like when your nurses are coming out to their homes, what are some of the things that they would do with their patients,
right,
to help them with these symptoms?
Well, first, I feel like it's important to understand too, like what the basis of our program is meant to help. So we are really, our specialty is the class C and class D of heart failure, heart disease patients. So class C is where they're having active symptoms. So at that point, we're just trying to help manage their symptoms, manage medication, help make sure that, the combination of meds that they're taking is being effective in reducing their symptoms, and also reducing whatever they're at risk for, whether that be, an artery block, whether they're having super high blood pressure, different things like that, making sure that we're effective to keep them at like a normal baseline.
Okay.
And then that class D classification we help with is someone who has the advanced heart disease. So they are unfortunately kind of towards the end of their race with the disease. We're just helping them basically identify some end of life goals, help them, maintain as much normality in their condition as they can, and really just helping guide them of, rehospitalization is a big thing with this category. So we have to really help them know. We actually have a chart that basically shows, okay, if you're having this symptom, you need to call us. You're in the yellow. So if you're having shortness of breath, you need to give CenterWell a call first, mm-hmm. and then we will, we might tell you to go to the hospital, or you might need to take a med that maybe is prescribed to you if you haven't taken it, different things like that. It's different guidance. Yeah. If you're just, maybe you're kind of having anxiety about, oh my gosh, like I could be having some kind of attack, I don't know. We'll go over that, and you'll see if you're in the green based on like no shortness of breath, something like that would be like you're in the green. Just be cautious, call us if you need us, but you should be okay.
That's nice to know that they can call you.
Right.
If you've got that anxiety, you've got that fear,
24 hours a day, they have a number.
Someone is there.
And then, of course, the red category, it's, you cannot breathe. You feel like you're suffocating. Different other things like that will put you in the red. And that is when it says call 911. Don't even call us, call 911. And that is really for patient safety. But what we have is basically 7 areas that we really help a cardiovascular disease patient with. And a couple of those things, kind of what you talked about, we're gonna go over lifestyle changes. What changes do they need to make? Because sometimes too, they can't get out and exercise that much because it puts them at risk. Mm-hmm. So, what things can they do that it would be healthy for the heart, keep them active as they can be? What diet modifications do they need to make? Is it less sodium? Is it, less red meats? What is it? We help them identify that as well. Yeah. We're going to help them manage the medications because, as we know, when you start combining a lot of meds, there can be other symptoms that develop. Absolutely. So trying to manage, we need you to take everything that is for your condition that helps you, but, we're going to also try to make sure you're not having these extreme other symptoms. So working with your physician as well and making sure that, if we see a couple of prescriptions in your household that aren't on your med list, we're going to be calling that doctor and saying, okay, well, we have a couple more prescriptions here that they're taking, what do we need to do about this? Nice. So really just us being in the house. So those are just a couple of things, but having us help. And, especially when you have the advanced, heart disease person or patient, they are just basically probably fearful all the time that something's going wrong. So what we're doing is seeing them multiple times a week. We're helping monitor them alongside their physician. We're keeping their physician updated on their progress, especially in that advanced stage, because every minute can change. It's important. Yeah. So usually at that point, we're seeing them quite a few times a week. We are just helping keep that communication line open, and also to, helping that family just feel like they have more support, because going to, our doctors do so much, but going to see them even once a week is not enough, especially when you're in an advanced stage in some kind of chronic disease. Yeah. So we really just
changes aren't easy to make. So it's like having that support. We've all been there. And, even if you're relatively healthy, younger, changes are not easy. It's like you always kind of need like a buddy system. You need people there to show their support, but also to, encourage you along the way. Absolutely. It's not easy to do, especially as you get older.
Well, and you can probably relate to this too. How many times does, a person, maybe it is diabetes, maybe it is a cardiovascular disease or something going on with your stomach, whatever it is, how many times, because our doctors stay so busy and they do so much, how many times they say, okay, you have this, here's a packet of information, read about it, learn about it. That's where home health comes in. We appreciate our physicians so much, but we understand that they don't have the time. They don't have the time to answer all the questions, to fully educate. Maybe that patient's calling up multiple times a day to the office saying, hey, I don't understand this. Yeah. Especially if you have Medicare, use home health as a resource. We are here to help you.
100%.
Even just educate you more about your condition, even if it's outside of diabetes, heart disease, whatever it is, ask us more questions. Let us come help monitor you. It is a nurse in your home coming to help you. I mean, that is a blessing, especially if you have, an insurance that would cover home health. Definitely use it.
Take advantage. Yeah.
And so that's the thing.
It's an amazing tool to have.
Right. Yeah. And, too, I know for us, where we kind of come in, and the thing that makes us work together basically is we're clinical. How many times have you guys, gotten a call of, well, I need help with my medications. That's where we come in. But how many times do we get the call of, okay, well, she can't, the patient can't bathe herself anymore. She can't do things around the house. Is this something you guys can help with? And that's where I feel like you guys come in. So I feel like we can relate this. How, if we have a patient who has cardiovascular disease specifically, and they're kind of in that stage C or D where they're struggling and trying to get back on track, how does Right at Home come in and kind of help us? Because you definitely know more about that side of things.
Yeah, I mean, as anybody starts to decline, general just issues with strength, everyone gets a little weaker, loss of muscle mass, not able to stand for long periods of time, not able to stand up or initially sit down on their own without falling or tumbling. Things like this all start to become more difficult as we age, and we absolutely can be there to help people with transferring, with ambulation assistance, being that support for them as they're walking to and from, one room to another, or to and from their wheelchair, and getting them into a shower so that they can feel clean, feel better about themselves.
That's such a big deal
Dress,
too.
yeah, grooming, shave, brush their teeth, brush their hair. If it's a woman, she wants to do her makeup. She hasn't done her makeup in months. Let's help her with that. Do some skincare. And then, and just helping with other things around the house that sometimes people don't always think about, but, maintaining cleanliness,
Right.
helping them with laundry, vacuuming, sweeping, all that good stuff. Preparing meals, making sure that, trying to encourage them to eat a little better, making sure they get something in their stomach, liquids if needed. And, just making them feel human,
Right.
Making them, sometimes people get into sort of a funk where they just feel defeated. They feel like everything's stacking up against them. We want someone to come in and, that just personality wise, they get along with, they're able to have a conversation with, be engaging with them, and just it keeps them company and let them know like they have a friend in their corner, they have someone there.
And I love that too, because, something that, with home health, we're usually there from 30 minutes to an hour. Sometimes startup cares can be longer, and, the visits just depend, but you guys provide companionship too. And I think that that's what's so beautiful about caregiving in general, is that support, and that's why we can work together. And that's what I love about it though. And that's why I wanted to make sure that, when we are talking about cardiovascular disease of any realm, it's not just a home health that could come in and help. There are other programs like Right at Home that we can work alongside with to better that patient's quality of life.
Yes.
Whether they're in the thick of it and they're going to be okay, if we're just trying to figure out, how are we managing symptoms and they're kind of feeling just weaker than usual, or
less, tire easily,
right?
Not being able to breathe easily.
Absolutely.
Everything feels monumental. Every little task to them just feels like such a feat. That's,
And too, being
very specialized.
Like that class D side that we talked about, that advanced heart disease, I feel like you guys are super beneficial because that takes some of the stress off the family, where they can just come and enjoy, their
being
time.
Family.
Yes, they just enjoy their time with each other. They're not worried about, the details of bathing and taking care,
Yes.
cooking for that, brushing the teeth, shaving, kind of all those things you said. They're focused on their loved one. And so I think that that's where we can really continue to work together. And that's what I want the community to know about the resources and how we can partner up. But also too, if you know anybody or have a loved one who, has a condition and they haven't had home health yet, they're skeptical of it, always ask questions, whether it be, if you have a caregiver, but you don't have home health yet, always ask them. They know of resources. Mm-hmm. Same thing with me. I get calls all the time, hey, I need this done. Okay, let me give you Megan's number or some of my other friends here at Right at Home. That's just kind of how we work. And it's just that we're here to help. And so we just want to be a resource. That's really what this is.
Absolutely. And anything, it's teamwork. Anything that we can do to just help make people's lives better. That's our goal. That's our mission.
Yeah. So, today we kind of talked about what programs we can offer when it comes to cardiovascular disease in honor of Heart Care Month. And so that's why we just kind of wanted to sit down and chit chat about it. I wanted to make sure that, we kept the details of the program out there to the community, and we pushed them out and made sure that we got them there. And I just really want to thank you for having us and having me. So if there's anything you guys ever need, please let me know.
It's like a no-brainer, honestly. Yeah. No, I enjoy, of course, seeing you anytime. Our little busy bee. It's always a pleasure to have you here. But yes, I just want more people to be aware of the resources available to them. And, don't be shy. Like give us a try. Give home care a try. Give home health a try. It's not anything to be too prideful about that, oh, I don't need the help, or, just give it a try. You never know. I feel like there are so many great benefits to having us as a team.
Absolutely.
Or any agency as, a little duo together. Coming in and helping people live out their lives to the best of their ability. And so, yes, anytime that we need anything, skilled nursing, physical therapy, you are definitely on our list to call right away.
Well, thank you. And if anybody out there has any questions, some of the things that we talked about, that chart that shows your green, yellow, red areas, how we can help with the 7 steps for someone with a cardiovascular issue, please let me know and please reach out to me. I'd love to share that information with you and answer any questions anybody may have. So
yeah, it's free to call, free to just ask some questions. And for myself, if you needed me to come out, I'm happy to come to your home and meet with you directly and speak with you. It doesn't cost anything, just to provide resources and answer questions. So yeah, Megan Lane with Right at Home.
Carlee Coggins with CenterWell Home Health. Thank you so much.
Yeah.